Hello and welcome to Young Turks, the show that's been bringing you entrepreneurial stories to your television sets for the past 11 years. I'm Shireen Bhan. Stem cell research and treatment have been gaining ground over the last few years. To put it simply, the idea behind stem cell research and treatments is a type of intervention which introduces new adult stem cells into damaged tissue to treat disease or an injury. Now, many medical researchers believe that stem cell treatments have the potential to be a game changer in the world of medicine. This treatment is particularly relevant to India and can help Indians diagnosed with blood cancer and children with thalassemia. Now, according to the Indian Stem Cell Transplant Registry, the number of blood stem cell transplants done in India till 2011 stands at a measly 4,015. These numbers help us understand that it's imperative to move towards making blood stem cell treatments more cost-effective and affordable to more patients. Contributing to this cause is 26-year-old Satyan Sangvi, whose venture Regenerative Medical Services makes both stem cell banking and bone and cartilage regeneration accessible to Indians. Join us as we find out how Satyan helps patients regrow.
Hi, I'm Satyan Sangvi, 26 years old. I've done my master's in stem cell technology from UK, and I love traveling, sports and reading.
He's no stranger to the world of medicine. 26-year-old Satyan Sangvi grew up watching his father Yash Sangvi run Satyan Pharmaceuticals, a company he founded in 1984 to manufacture and distribute active pharmaceutical ingredients or APIs. 2 decades to medicine with RMS Regrow, a company which specializes in cell therapy and cord blood banking. Satyan claims to be one of India's first stem cell technology experts, and under his watch, RMS Regrow has set up one of India's first state-of-the-art labs with a focus on bone and cartilage regenerative treatments. RMS provides a number of services like Baby Cell, where parents can preserve their baby's cord blood for 21 years to cater for future disorders. With the mainstreaming of stem cell treatments, opportunities are growing, and Satyan hopes to close the year with an EBITDA of 12 crore rupees, while the parent company, Satyan Pharma, hopes to close a turnover of 375 crore rupees this year and a target of 500 crore rupees by next year. Satyan says the decision to invest in stem cell research was not an easy one.
We basically had a huge risk we had taken in initially setting up this venture. We invested roughly around 45 crore rupees in 2009 when we set up the laboratory and the infrastructure. And all of this investment came in from the parent company of Regenerative Medical Services, which is Satyan Pharmaceuticals, which is run by my father, Mr. Yash Sangvi. And they basically are an API distribution firm. They also, it was very early to invest so much of money in the early stages. Even today, we feel that the stem cell industry is in a very nascent stage, but I think it's picking up now with more and more attention being given to the stem cell banking as well as the therapy. And more than ever, then the doctors have now started accepting this procedure as the routine medical procedures within the hospital treatments.
This is the RMS Regrow lab in Lonavala on the outskirts of Pune. Developed in collaboration with South Korea's Sivon Cellon Tech, this is the only lab in India that provides cell culturing and regeneration of cartilage and bone cells. With 27 centers across India and partner hospitals like Max Healthcare and Kokilaben Ambani Hospitals, Satyan claims 5,000 parents have banked with RMS Regrow so far, and 300 samples are banked monthly. With a registration fee of 5,000 rupees, parents are charged between 65,000 to 90,000 rupees to avail of the baby cell services. But how can regenerative treatments be made more accessible?
What is available right now is with the baby cell, we made it more accessible, and we are trying to push it down right to the make it accessible and affordable to all the sectors in the all the middle class, the of the Indian population by giving EMI options. We have low EMI options available. We have basically rolling out newborn screening tests, which is an important metabolic disorder screening test. We're so passionate about our baby cell business that we actually give value-added services to them, which are health-related, health beneficial.
While baby cell accounts for 65% of RMS Regrow's revenue stream, Satyan says the remaining 35% comes from Osron or autologous bone implantation and Chondron, a treatment involving autologous cartilage implantation for treating knee, shoulder and ankle cartilage injuries. Priced at up to 2 lakh rupees and offered in 22 locations across India, the therapy helps regenerate damaged cartilage tissue and in doing so helps avoid replacement surgeries, especially for athletes and young adults.
I think in orthopedic sector there is only possible treatment available is joint replacement surgeries, which doesn't have the patients are then left out without any kind of physical mobility much and no sporting activities left. But here what we do is basically a patient friendly treatment, patient specific cell therapy. So the cartilage piece is taken from the patient, it is cultured over 4 to 5 weeks in the laboratory, and then this sent back to the hospital for the implantation in the cartilage defect area in the knee joints. So this basically then grows into normal cartilage, which is as per the pre-injury mode. This enables young cricketers, athletes, young sportsmen anywhere in between the age of 15 to 65 can get this treatment available at all major hospitals.
When this young scientist isn't working in his lab, he unwinds with friends on the squash court. With an eye on reaching out to a larger population, Satyan is connecting with NGOs and is focused on developing new therapies to address the needs of underprivileged children born with a cleft lip and palate. After a promising start, Satyan is putting a sustainable game plan in place, which includes extending the range of services that RMS currently provides. His next shot will be to customize cell technology to extend cartilage and bone treatment to the spine, hip, oral as well as dental reconstructive areas. Satyan, here's hoping you continue to push the limits of healthcare.